Thank you very much for the invitation and the very kind reception. It is for me a great pleasure to be here on the second European Biosafety Summit. Indeed, in this area we had already developed a very close cooperation because this is an important part of our work, and I would like to thank the organizers for putting together a very interesting program for today. One of the main objectives of EU social policy, as you know, is to create more and better quality jobs. However, this will not be possible if we do not ensure that European workers have access to a safe and healthy working environment. Every year there are an estimated 1 million accidents in the EU involving sharp objects such as needlesticks. This can not only have devastating effects on the individuals concerned as well as the families, but it can also be a major burden for Member States' health services. The healthcare sector is one of the biggest employers in Europe. People need to know when they go to work that the workplace is a safe environment. This is something that the Commission takes very seriously. It is not only a legal duty, but also a moral obligation. Ladies and gentlemen, the last year marked an important step forward in this field. EU employment and social affairs ministers adopted a directive to prevent injuries and infections to healthcare workers from sharp objects such as needlesticks. The directive sets out an integrated approach to assessing and preventing risk, as well as to training and informing workers. As you know, this directive translates into EU law the framework agreement negotiated by the European Hospital and Healthcare Employers Association, HOSPIN, and the European Federation of Public Services Unions, EPSU, which together cover around 3.5 million people. It is the culmination of a very long process with valuable input from the European social partners, employers and workers' organizations, the European institutions and other relevant actors in the healthcare sector. The European Parliament, in particular, played a very important role in kick-starting the process with the resolution in July 2005, which called on the Commission to submit a legislative proposal specifically addressing the risk of working with needles. In addition, I would like to emphasize the responsible and effective way in which HOSPIM and EPSU conducted the negotiations and finally concluded the framework agreement. This has been a very good example of European social dialogue, proposing practical and effective solutions to health and safety at work to make a real and positive change, positive difference in terms of the quality of jobs in this sector. Ladies and gentlemen, the directive on the prevention of sharp injuries is an important step forward in creating the safest possible working environment for workers in the hospital and healthcare sector. The challenge now is to ensure its effective and complete implementation by the Member States. A key element to this will be the active involvement of all the relevant stakeholders, including the social partners, public authorities, health and safety professionals, insurance companies, medical device producers, research institutions, and labour inspectorates. I'm very pleased to see so many of you are here today from these actors or organizations. I know that you are actively involved with and committed to the directive's effective implementation. I welcome the initiatives taken by the European Biosafety Network to support and facilitate the implementation process, in particular the information and guidance material which you have prepared and disseminated. Ladies and gentlemen, legislation is a vital part of ensuring health and safety in the workplace, but it is not the only tool that we must use. Providing information, raising awareness, and sharing good practice are also crucial for achieving an effective prevention. Events like the second European Biosafety Summit are an essential part of this process. As part of this, the Commission is also participating in various events in different member states. Furthermore, we are working together with the European Agency for Safety and Health at Work to collect and disseminate useful information and examples of good practice in support of the directive's effective implementation. In addition, the Commission is co-financing specific projects as part of the European Social Dialogue. For example, we are currently providing financial support for the project Strengthening Social Dialogue in the Hospital Sector in the Baltic countries, which is run by HOSPIN and supported by EFSU. The project aims in particular to improve the dissemination of the priorities and outcomes of the sectoral social dialogue in the Baltic countries, as well as to help share good practice on some of the core priority actions of the sectoral dialogue between EFSU and HOSPIN. It also specifically addresses preventing injuries from sharps in the hospital and healthcare sector. This is another good example of practical action resulting from an effective social dialogue. Ladies and gentlemen, our healthcare systems are a key part of the European social model. Across Europe, they are greatly appreciated by our citizens, especially in such difficult times. Ultimately, the health and safety of workers in the hospital and healthcare sector underpins the quality of care for patients and is closely linked with their health. Preventing sharp injuries is not only necessary for workers' health and safety, but also for the continued efficiency of European health services. We need a healthy, motivated and well-trained healthcare workforce. To do this, it is vital that we ensure the complete and effective implementation of the directive, implementing the framework agreement on the prevention from sharp injuries in the hospital and healthcare sector. I count on your continued support to make this a reality. Thank you very much.